D for dog. Correct. Last question. Question 29. REM behavior disorder is primarily characterized by A. Lack of REM sleep. B. Daytime somnolence. C. Absence of hypotonia during REM sleep. D. Absence of PGO spikes during REM sleep. C for cat. Correct. Next team, Team C. Provide your questions.
4, 8, 12, 16, and 20.
4, 8, 16, 12, 16, and
20.
20. Let's hold on for a few seconds. Team C. Start with the first question. Question number 4. Which of the following blocks the rhinodine receptor? A. Dantrolene. B. Curare. C. Cocaine. D. Hexamethonium.
A for apple.
Correct. Question number 8. Which of the following statements about Agril Robertson pupil? Which of the following statements about Agile Robertson pupil is incorrect? A. Light reflex is absent. B. Accommodation reflex is present. C. The lesion is in the Edinger-Westphal nucleus. D. It occurs in neurosyphilis.
C for cat.
Correct. Question 12. The circadian rhythm generator in the hypothalamus receives inputs chiefly from A. Retina. B. Superior colliculus. C. Thalamus. D. Medial geniculate nucleus.
A for apple.
Correct. Question 16. The hypertensive form of congenital adrenal hyperplasia is due to a deficiency of A. 11 beta hydroxylase, B. 21 hydroxylase, C. 3 beta 2 hydroxysteroid dehydrogenase, D. DHEA sulfokinase.
B for boy.
Wrong. Question 20. Hereditary spherocytosis occurs due to mutations in genes coding for A. Spectrin and ankyrin, B. Sodium potassium ATPase, C. Glucose 6-phosphate dehydrogenase, D. Pyruvate kinase.
A for apple.
Correct. Well done, Team C. Next up, Team D. Team D. Provide your questions.
Question 2, 6, 9, 10, and 21.
Question 2, 6, 9, 10, and 30.
21.
First question. 100 milligrams of sucrose is injected intravenously into an adult male weighing 70 kilograms. The plasma concentration of sucrose after mixing is 0.01 milligrams per milliliter. If 5 milligrams of sucrose has been metabolized during this period, the ECF volume in this individual is approximately A. 6 liters, B. 9.5 liters, C. 14 liters, D. 17.5 liters. Option B, D.
F for apple, apple. C.
It increases ventricular activation time. C. It lengthens the duration of ventricular repolarization. D. Correct. Well done, Team D. Next up, Team A. Provide your questions.
$11, $15, $18, $22, and $25.
First question, number 11. The process of conversion of short-term memories to long-term memories occurs in the A. Hippocampus, B. Amygdala, C. Cerebral cortex, D. Hypothalamus.
F for apple.
Correct. Question 15. The hormone that is synthesized only in the zona glomerulosa is A. DHEA, B. Aldosterone, C. Corticosterone, D. Deoxycorticosterone.
B for boy.
Correct. Question 18. Enterocytes are replenished by mitotically active undifferentiated cells located in A. Brunner's glands, B. Crypts of Lieberkühn, C. Peyer's patches, D. Gut-associated lymphoid tissue.
B for boy.
Correct. Question 22. The FEV1 stroke FVC ratio is normally greater than A. 0.8, B. 0.7, C. 0.9, D. 0.5.
B for boy.
Wrong. Last question. Question 25. The neurons pacing spontaneous breathing are located in A. Pneumotaxic center, B. Apneustic center, C. Pre-Botzinger complex, D. Dorsal motor nucleus of vagus.
F for apple.
Wrong. Well done, Team A. The order for this session is Team C first, Team D, Team A, then Team B. Team C, select 5 questions.
Two, 5, 13, 17, and 10.
Straight up, question 1, number 2. First question, number 2. A 55-year-old man presents with fatigue and jaundice. His serum bilirubin is elevated, predominantly unconjugated. Which of the following conditions is most likely? A. Biliary obstruction. B. Hemolysis. C. Hepatitis. D. Crigler-Najjar syndrome type 2. Is primarily responsible to
A for apple.
Correct. Question 13. Which of the following enzyme deficiency leads to hemolytic anemia? A. Glucokinase. B. Pyruvate kinase. C. Phosphoglucomutase. D. Phosphofructokinase.
B for boy.
Correct. Question 17. Which of the following is a common compound shared by the TCA cycle and urea cycle? A. Alpha ketoglutarate. B. Succinyl-CoA. C. Oxaloacetate. D. Fumarate.
D for dog.
Correct. Last question. Number 10. Which of the following tests is the most reliable in assessing long-term glycemic control in diabetic patients? A. Fasting blood glucose. B. Oral glucose tolerance test. C. HbA1c. D. Random blood glucose.
C for cat.
Correct. Well done, Team C. Next, Team D. Select your questions.
Let us go 1, 4, 8, 12, and 16.
One, 4, 8, 12, and 16. First question. Number 1. Which of the following conditions is most likely to result in a decreased anion gap? A. Diabetic ketoacidosis. B. Renal failure. C. C. ALT. C. ALT. D. ALP.
If B for Barbie.
Wrong. Question 12. Which of the following enzymes leads to a glycogen storage disease known as Taruy's disease? A. Glucokinase. B. Pyruvate kinase. C. Phosphofructokinase. D. Phosphoglucomutase.
C.
Correct. Last question. Number 16. Tay-Sachs disease is the result of a genetic defect in the metabolism of A. Triacyl. Select 5 questions.
Question 6, 9, 6, 9, 14, 18, 23.
6, 9, 14, 18, 23. First question. Number 6. Which of the following laboratory findings is most consistent with a diagnosis of primary hypothyroidism? A. Decreased TSH, decreased free T4. B. Increased TSH, decreased free T4. C. Increased TSH, increased free T4. D. Decreased TSH, increased free.
B for boy.
Correct. Is found to describe. Your answer is question 14. Which of the following D. fructose 1,6-bisphosphate. Wrong. Question 18. Which of the following amino acids can covalently bind ammonia, transport and store it in a non-toxic form? A. Aspartate. B. Glutamine. C. Glutamate. D. Cysteine.
C for cat.
Correct. Last question. Please choose another question, another number as your last question.
Twenty.
20. All other conditions of ketosis except one. All are conditions of ketosis except which one? A. Von Guy's disease. B. High carbohydrate diet. C. Improperly managed diabetes mellitus. D. Starvation.
F for apple.
Wrong. Well done, Team A. Next up, Team B.
Three, 15, 22, 7, 11.
First question, number 3. Support a diagnosis of lactic acidosis. A. Decreased blood pH, increased anion gap, increased lactate. B. Decreased blood pH, normal anion gap, increased lactate. C. Decreased blood pH, increased anion gap, normal lactate. D. Normal.
A for apple.
Correct. Number 15. The glycerol phosphate shuttle functions in A. Lipid catabolism. B. Triglyceride synthesis. C. Anaerobic glycolysis for regeneration of NAD. D. Aerobic glycolysis to transport NADH equivalents resulting from glycolysis into mitochondria.
D for dog.
Correct. Question 22. Question 7. A 40-year-old woman presents with bone pain and recurrent fractures. Laboratory investigations reveal increased serum calcium and decreased phosphate. What is the most likely diagnosis? A. Hypoparathyroidism. B. Osteoporosis. C. Primary hyperparathyroidism. D. Vitamin C deficiency.
A for apple.
Wrong. Question 11. Which of the following enzymes are not involved in galactose metabolism? A. Galactokinase. B. Glucokinase. C. Galactose 1-phosphate uridyl transferase. D. UDP galactose 4 epimerase.
B for boy.
No, we are done.
Histogenation.
C. Transamination.
Wrong. Thank you very much for being a perfect audience. Still, best of luck to the teams. I remain Christine Eve Alobo.
Okay, thank you very much. So far, so good, so well. The group that got most claps has a concern. I would like to invite them back again to confirm the questions they went to. That's group D. Kindly, let's check through the questions. You kindly tell us the questions you did, and then we see if they were projected.
We did question 1, 4, 4. One was done. No, we didn't do that one. We didn't do that question.
Our greatest apologies are they hadn't done one of their questions, so we'll give them the chance to complete that.
You can answer. Okay. Okay, let me read it. A patient with hypokalemia is found to have metabolic alkalosis. Which of the following is the most likely cause? A. Diarrhea. B. Renal tubular acidosis. C. Hyperaldosteronism. D. Chronic kidney disease.
Let us go A.
That's wrong. Well done. A vote of thanks to my colleague, the moderator, who has been taking you through the previous session. And that was biomedicals. Right now we are going into the preclinicals. Yes, we shall start with microbiology. Okay, there's a glitch in microbiology. Let's start with pathology. Group A. You will start with group 12, eh? 20. Okay. Let's start from 11. Which of the following is overexpressed in patients with Burkitt lymphoma? A. Proto-oncogene C, MYC. B. Oncogene C, MYC. C. CMYC gene. D. CMYC mitogen. And E. CMYC protein.
B for boy.
That's correct. Number 18. With exception of one, all of the following are possible causes of pre-renal renal failure. A. Cardiogenic shock. B. Multiple myeloma. C. Intestinal obstruction. And D. Anaphylactic shock.
B for boy.
Correct. Number 9. A 29-year-old female presents with history of severe menorrhagia and profuse bleeding following tooth extraction. No family history of bleeding disorders, and her past medical history is unremarkable. Only menorrhagia. Drug history. The patient is not on anticoagulants and not allergic to any medications. On exam, the patient looks unwell, slightly pale. The systemic review, not applicable. Lab investigations, bleeding likely diagnosed. Positive result from interferon gamma release assay is the same as which of the following? A. Tuberculin skin test of less than 5 millimeters. B. Tuberculin skin test of more than 5 millimeters. C. A tuberculin skin test of less than 5 centimeters. D. Tuberculin skin test of more than 5 centimeters. And E. The tuberculin skin test of more than 0.5 centimeters.
D for dog.
That's wrong. Answer is B. Next question. The following are some of the important causes of left-sided heart failure, except copalmonale. B. Hypertension. C. Ischemic heart disease. D. Mitral valve stenosis.
F for apple.
That's correct. Thank you very much.
1, 6, 7, 19.
10, 19, 23. Straight away to 1. Is a tumor associated with hirsutism among females? A. Adrenocortical tumor. B. Pineal gland tumor. C. Pituitary adenoma. D. Renal cell carcinoma. E. Renal oncocytoma.
F for apple.
That's correct. 6. A small mutation. D. Oncogene. And E. A A proto-oncogene.
B for boy.
That's correct. Next is number 7. Is a type of mutation in which the insertion or deletion of nucleotide bases in numbers are not multiples of 3. A, point mutation. B, conservative mutation. C. Thank you. Next question.
I think we should get a warning.
They are 30 seconds. Yes? No, let's proceed. Remember that one of the instructions was that unanswered questions will be given to the audience at the end of the quiz. Next question is question 19. Which of the following is not an example of an oncogene? A, CMYC. B, cyclin D. C, WT1. D, KRAS.
B for boy.
B for boy. Okay, that's wrong. Next question is 23. Accelerated or malignant hypertension is a clinical syndrome characterized by all of the following, circle the incorrect